I'm going to take off. So Joel, if you want to introduce your guests, and I will see you guys later.
Cool. Thanks, Katie. Okay, well, welcome. Luke just wrote, hi, Luke, how are you? Luke's on. Cool. Afternoon, everybody. So I wanted to welcome you guys to our Zoom meeting today with DCYF. We have Nicole Rose and Jason, who will be talking to you today about childcare. And we thought it would be good. We've been getting a lot of questions from directors, staff, and parents about all the various and fairly fast-moving changes, particularly around Working Connections childcare. And so we wanted to bring folks from DCYF directly to you guys so that they could present a few minutes and then also just take questions. And I know we have quite a few people on this call. And so that is it. And I wanted to turn it over to Nicole and Jason. I thought you guys, I sent you a few suggestions for the Zoom and some of the things that I've been hearing, but I thought maybe you guys could present for a few minutes and then, we'll just kind of open it up for questions from there. So Nicole, hopefully are you unmuted? Yeah, there you go. Hi, I'm Jason. I think so.
I'm here. Hi. So hi, everybody. Thank you for being here, and thank you for the opportunity to share what's happening at the Department of Children, Youth, and Families as it relates to child care subsidy. So one, I just want to acknowledge that these are challenging times, and so if you are continuing to provide care, thank you for providing care. And for families, thank you for your patience as we've worked through, and for providers as well, quite honestly, thank you for your patience as we've tried to work through and get some answers to questions. That really is our goal. And so we've tried to, I think, really work on what are some things that we can begin to do to try and stabilize access to care, not only right now, but as Stay Home, Stay Healthy is lifted, looking at what potentially happens in the summer, and have really been trying to coordinate conversations across schools, providers, and others. So there are a variety of policy decisions that we've been able to make that we hope are heading us in the right direction. And so I will turn it over to Jason to talk specifically about those policy decisions as they relate to subsidy. And after that, I'm happy to answer any sort of broader questions around the work that we're trying to do. We're also wanting to make sure that we are following the guidance that we're getting from the Department of Health, just to ensure that those who are still providing care or going to care are as safe as possible. So Jason?
Yeah, good afternoon. Thank you, Nicole. And thank you, everybody, for inviting us to just come and talk and give updates around child care subsidy. For those of you who are really interested, I cut my own hair, and it is about time for a new cut. It's just one of the benefits of keeping hair short, very short, I guess. I just wanted to give a quick recap. We had a lot of activity in the child care subsidy realm towards the later part of March, as we made a lot of emergency rules and a lot of changes. And then we made a second go around of those changes, extending them through May and June, depending on which change we're talking about. So I'm just going to give a quick recap of the four main areas that we have impacted subsidy. The first one impacts primarily providers and families, and that is extending school age authorizations. For school age children, we typically authorize half-day units, and during the school year, we authorize 30 half-day units. In March, we automatically increased everybody to 38, so we added 8 half-day authorizations to cover the second half of March. And then in April and May, we added 16 half-day units for a total of 46 half-day units, meaning that all school-age children who are typically eligible for full-time care are eligible for the equivalent of up to 23 full days Essentially, we just moved our summer process into happening on March 16th. There was a series of actions that we took manually before we made the decision to do that automatically. So some providers may have been authorized a little bit differently. And hopefully we have everybody squared away for March at this point. If providers have questions about being authorized and making sure that we had the right payment, providers can call the provider line and we'll look at the cases individually. We made a lot of manual work to make sure that we were getting cases authorized before we got approval to do the automated changes. I think I'll just run through these and then we can shoot for questions at the end since it's a Zoom meeting and there's quite a few of us, if that works. The other significant change that we made was we decided to pay providers based on enrollment versus attendance. And this is specifically from March 16th through the end of June 30th. What this does is allow providers who are closed due to COVID, and this is what we have said is closed to any reason due to COVID and not specifically due to any one specific reason due to COVID-19, but there's a variety of different reasons, and we can go through some examples at the end. This allows providers to claim what they were authorized and expected to provide in terms of care for families receiving subsidy when they're closed specifically due to COVID, and the closure is temporary. So folks who plan on closing and reopening in the future due to COVID, we're continuing the authorizations for the subsidy families. I think this was a significant decision and something that hopefully is really helpful for providers.
Yep.
And I want to highlight what you just said right there. It's around temporary closures related to COVID-19. So it's not anybody who decides to close. So it's very specific.
The other primary change that is impacting providers is that we waived copays for April, May, and June for families. So families will not have the responsibility of paying the copay, and the state will pay the family's copay on behalf of the family for them. Again, that's April, May, and June. And the last primary change we made really impacts families, but it also maintains family eligibility for providers. The last change is for families who are renewing their eligibility in March, April, and May. We are continuing their activity as if it continues if their activity has ended due to COVID. So the primary example is somebody was working in maybe a retail setting in a mall and the malls have closed. That person who, if they reapplied, we would continue as if they were working and are continuing the authorization as if they were continuing with that activity. Again, as long as it was closed due to COVID and as long as the families retain all of their eligibility criteria. We're trying to maintain family access, but also trying to help sustain providers with that change as well. So that was a quick recap of the 4 primary areas that we've made changes and some significant changes in subsidy, and definitely open to questions, whether you want to chat those in the chat or if you want to chime in over the Zoom. Either way.
Yeah, thanks, Jason and Nicole. One of the just to get things going, let's talk a little bit about what happens if a program decides to close as a result of COVID. What does it mean to be as a result of COVID? Is that I'm fearful of, you know, I mean, what does that, describe that a little bit more? I mean, not every reason is going to be COVID, but you don't have to have an outbreak. You don't have, I mean, where's the line on this?
So I just want to say, I think it's a really fine line, I think is what I would say. And I think this is where DCYF encouraging providers to really use their best judgment. But I think the common examples that you might think of potentially, am I in a high risk category? Was there an exposure at the site and I need to shut down for a couple of days to do some disinfecting and deep cleaning? So I think there could be a variety of reasons, but I would say that fear is not one of the reasons. Jason?
I think generally going back to the guidelines that we see from the CDC and the Department of Health around closures, around high risk, or I would even say providers who are in the school districts who are closed due to COVID, and you're using school district facilities and you're trying to figure out how to get those back open. I would see that fit in there as well.
Who do they, if somebody decides to temporarily close and has a good faith reason, who is it that they tell? Is it their licensor? Do they call you guys? What's the process for doing that? And what happens if I closed previously because of COVID, but the policy was more limited then, and now it seems to be a little bit more expansive? Can I still get paid out from that time? And what happens if I close like early March, when this was happening?
So they should be telling their licensor when this happens and reporting this data in WA Compass, because we're really trying to get a sense of capacity and who's staying open and closed. And there's something in Compass for them to put in that the closure is related to COVID-19. And I'll let Jason speak to your other question about the date and timing.
Yeah, the date and timing, the official decision that we had was made probably late March-ish. And so there was some initial guidance around, and one of our FAQs specifically said that there had to be closed due to a confirmed case. So that was initial guidance, and that has been rescinded. So it's any reason due to COVID, and we can backdate authorizations. The subsidy team is working through that process. Any case that happened to have been closed prior, the provider can call the provider line, and we can look at the case and get cases reauthorized for those folks who were closed before and their authorizations have closed prior to that guidance.
Okay. Before there's a couple chats in there, but I guess my other, on the flip side of this, what ways are we supporting people who do stay open? I know Sarah Clark and John Burbank, Luke, there's a bunch of people that are really looking at the issue of healthcare. For instance, that, something like 6,000 childcare workers who don't have any health insurance at all, and then they're already being paid, well, kind of crappy. And now they're doing something a little bit, more dangerous. So what have we done to try to shore up the system to make sure those people get health care or more pay, or for people who do stay open at least?
Yeah, so I think that's a great question, Joel. And I think it's important for this group to know that, Jason talked about timing of decisions, and that really these decisions have to run up through the Office of Financial Management and the Governor's Office. It's not just DCYF making these decisions. And so we're trying to do those things as quickly as we possibly can. As far as the healthcare piece goes, right now, what we're really trying to do is refer people back to the Health Benefits Exchange, because they are having open enrollment for some of their programs due to the COVID-19 pandemic. I know that may not help everybody, but there have been conversations at the state level around how do we provide access to healthcare, and like I said, right now, just really trying to redirect people back to the Health Benefits Exchange. I think the other thing I would say around stabilizing the existing provider base is we were asked to really look at healthcare for childcare for essential workers in looking at the CCDF dollars, and now we're being asked to look at those dollars in a different way. And so I really do think that our goal is to think about how we stabilize care not only now, but we also recognize that we need to have some other conversations around what does childcare or any sort of formal care setting in the future look like. And so we're trying to engage in that planning and get some recommendations to Secretary Hunter so that he can take those to the executive team and others.
Yeah, thank you. Let me go to some of the chats and then we'll open it up for questions from people who want to ask some stuff. Okay. Okay, this goes back to the earlier question. Does any closure do, why don't I read them all and then there's not too many. Does any closure due to COVID mean that an infection has taken place of a staff or a child, or can be if a center has lost too many slots and can't afford to stay open? I think Sari's they've kind of answered that. There's going to be a little more flexibility there. Kevin Rutherford asks, so does this include homeless families? This is around the eligibility process and work activity. Same kind of question. Yes. Okay. Will the annual eligibility renewals be rescheduled or automatically approved for the next year? That's Hannah has that question. What say you, Jason, on that sort of this automatic renewal? And
yeah, so we can going back to the homeless families. Folks experiencing homelessness are eligible for the homeless grace period, and that's 4 months. We are not currently extending the homeless grace period for folks due to any reasons under COVID, but we do have the extension of HGP coming up very soon due to legislation, and we're working through what that looks like for families experiencing homelessness. So there isn't anything specific for families experiencing homelessness in HGP. The annual eligibility, families still need to apply and regain their eligibility. And part of the reason for that is families accept some responsibility for co-payments and those types of things, and have financial responsibility that they renew whenever they reapply. And so we're not just automatically extending everybody because there are other eligibility criteria besides just the approved activity. So families need to reapply to regain their 12-month eligibility. So providers, please let families know as you're getting those notices to say this family is due for review. Please ask the families to complete their reviews.
Jay, can I ask you a question about that? I'm thinking about it. So
yeah,
if let's say I'm a homeless family and I'm currently in the grace period, my 4-month grace period ends at the end of April. Am I then now having to meet the work activity? So I'm person A. Person B, though, they're in the 12-month authorization. They're going to get rolled over and they won't have to meet their work activity. So I have the homeless family having to meet it. The average person doesn't have to meet it.
Well, yes, but the HCP is for the first 4 months is the exception, not for the full 12 months. So if the family experiencing homelessness gained their activity and then lost it, they would get at the end of the 12 months re-extended. It's just right now we have the exception for those first 4 months, and it's a hard exception in our CCDF plan and our rules.
Okay, let me go to the, thanks, Jason. Let me go to the chats.
Joel, this is Marisela. Can I suggest something? Just go by questions because I get lost when you're asking and then Jason is responding. Can we go question by question, please?
You mean you want me to read them all first, or you want to?
No, one by one, and then he can respond. It will be easier. Thank you.
Okay, sure. All right, Danielle Rasmussen is asking, who and how do we reach out to know if our center situation would qualify us to bill for April, even though we were or are closed? Who do we talk to? Is Danielle Rasmussen the question?
You can call the provider line.
Okay. Sally Gundry, we are a Head Start agency with a child care partnership. We initially closed because we have in our policies that we close when the school districts close. Our agency had a staff member test positive for COVID after the fact. But even though we had a confirmed case and are past the 14-day quarantine, we remain closed because of our policy. Sorry, there's a... Okay, Sarah Clark, you have another question. It says, why are providers who are open not receiving hazard pay? I'm saying it with a little force because I think that's how you should probably say it. They are essential workers on the front line taking care of many children of healthcare providers who are exposed to the virus every day. Jason or Nicole, do you have anything more you want to say on the hazard pay healthcare thing?
So I think that it's a really good question, and we have policymakers who want to weigh in on how the dollars are spent, and so that's where we're trying to put some recommendations together. We had been tasked with doing one thing, now we're tasked with doing something else. So we are working on it. Okay.
Kelly Martin writes, are any additional stipends being considered for providers remaining open, considering additional staffing costs with ratios and limits to enrollment, additional janitorial cleaning costs, etc.?
So yes. And so it's the same response as the one before. And I think, you know, how we might look at this is just thinking about a stipend or a grant that maybe isn't necessarily tied to a particular thing, and thinking about sort of who gets access to that. The other thing I would just bring into the conversation is that typically when we're talking about money and funding, it's really around subsidy. And part of what we've also really heard is that how do we look at the provider system as a whole, including those that take private pay. And so that is, again, a decision that Secretary Hunter would take forward to executive team.
And just to be clear, Nicole, with the child care dollars, both the federal dollars that you have and the additional money, can you make direct payments to private pay even if people don't take subsidized care? So I'm like Kirkland Children's School. I don't do any subsidized care, but I need more resources in order to stay, you know, open. Or is that a possibility?
Yes, it is a possibility. There's actually a lot of flexibility with those CCDF dollars. They don't have some of the strings attached that the other CCDF dollars have. Jason, anything else you would add to that?
No, I think you got that covered.
Okay. I got a question from Luke out in Spokane. Luke, do you want to come on in? You might have to just unmute yourself.
*6, Luke.
Can you guys hear me?
Yep, we can hear you now.
Okay. All right. So hearing everybody so far, there's a lot of flexibility needed for providers, from hazard pay to renewals for families and pay for lost revenue. Has the department received funds federally yet? And has the department asked the state for additional funds related to COVID? Just, I guess the overall question is, these are a lot of things. We know that there was a huge need prior to this, and now this has added extra layer. So has the department been able to look for more funds? Is that something that you guys do? Yeah, that's my question.
So Luke, when you're talking about asking for more funds, are you meaning private funds, more state dollars, or just money in general?
Just money in general, wherever. I know the majority of funds come federally. Is that correct? And I think there's a fund that came for COVID specifically. Is that correct? But what I've been hearing is that's definitely not going to be enough. So I was wondering if the department was going to ask for additional federally, and if there was going to be any ask for the state.
Yeah. So I'm happy to take that, Jason, and then you can chime in. So we did just receive, I want to say it was just last week, the $58 million in Child Care Development Fund dollars. I think I mentioned before, the legislature wants to weigh in on the plan for those dollars. And so we are working on some proposals to get to Secretary Hunter to have him see what he wants to move forward with legislators and others. As far as additional dollars, we do have Allison Kretzinger, who's our Deputy Director of Government Affairs, is staying in touch with our congressional leaders. So as they think about more stimulus packages, we have shared with folks at Region 10 and others that the $58 million really doesn't get us very far. So we are trying to inform that voice related to childcare, but other pieces of the agency as well. And then I think your question around state funds is, I would like to say that we are asking for more money, but I think the reality is we're at a time where there's not going to be any more money, and we're going to have to think about where do we put our resources. One of the things that we're also trying to do after we work through what are some proposals around the new dollars is we know we've got to think about what does the cost of care look like moving forward, given the different group ratios.
Yeah. Thank you, Nicole.
The only thing I would add to that is I think the timing of the task force for the general state of childcare in Washington was probably a little delayed because a lot of that information would really help inform some of these decisions. But I think that's still the avenue to help really identify the costs going forward. I just wish we had that information a little sooner. But I know a few of us on this call are on that group, and I think that has a lot of influence in these decisions as well.
Yeah, and Cheryl Smith from Department of Commerce is joining some of the work that we're doing related to this. So, and I think from my perspective, it just really highlights again the need for childcare and childcare opportunities for folks to be able to work. And so it's unfortunate that it takes something like this, but I'm hoping that it really highlights the issue and the need.
Yeah, absolutely.
Thank you, Nicole and Jason. Appreciate it.
Hava from I think Child Care Resources, she's asking a similar question on the homeless grace period. We were told that the extension of the homeless grace period was going into effect for families approved as of March, and that they would be automatically extended to a year approval. Is that not correct? Is it true, Jason? It doesn't go into effect just yet, right?
Right. So we're working through the rules to implement the legislative ask of this. Right now, it is looking as if folks who are in their HCP in May would continue and ride out the remainder of their 12-month certification period. So as we go backward, that means families who apply and become eligible for HCP beginning February 1st, they would be eligible for the 12-month extension.
Okay. Nancy Diamond, if a family temporarily goes to another child care center because we are closed and plans to come back to our center to be reopened, can we be reimbursed during that time?
Yep. And we skipped Sally's question. She wants to make sure if she will qualify for payment given policy in her positive case. I'd say that is a perfect example of somebody closed due to COVID and you could bill or claim, based on enrollment. And then Nancy's question, this gets to family eligibility, and we are allowing families to be authorized in a second provider to obtain care and still be authorized in the first provider if they were temporarily closed due to COVID. We do have a few cases where that may not have happened in March prior to this policy change. Providers can call and ask for that with the provider line, and we will work through those cases on a case-by-case basis. There is one exception here, and of course, this all follows family eligibility. The family has to remain eligible, and we have a number of providers, probably even on this call, who operate multiple centers for the same business entity. We're not going to pay the same business entity twice for the same child.
Mm-hmm.
Alexandria, for families, here's another homeless grace period question. For families that are experiencing homelessness, if they have the homeless grace period, but their childcare closes and they are unable to find another childcare, will their grace period continue to run while they don't have a provider, even if the center was closed due to COVID?
That isn't a policy decision. We've only looked at the end of the certification period. Currently, they would receive their 4 months of HCP, and that is it.
Kelly, City of Seattle is paying for care for essential workers. King County is following suit. Many providers are providing free or reduced to essential workers. Is the state looking at something similar?
So I'll take that one. That was originally what we were tasked with looking at, and had talked with both King County and the City of Seattle, and we were asked to go a different direction. We had a pretty solid plan in place around emergency care, and I think there's a couple of things that happened. So one, I think the surge that we were expecting to see statewide, you see more happening in regional areas. And I think the second thing that happened was, as some briefings happened with legislators, they questioned the use of the $58 million for that purpose, and have asked us to rethink some of that. And again, these decisions were made in consultation with Secretary Hunter and the governor's executive team. So yes, we did look at that. I think we have a solid plan in place if we need to implement something regionally, but we've been asked to look at the $58 million differently, which is really about how do we stabilize the provider base and how do we ensure that low-income children and families have access to care.
Yeah, I think that's good. I think we'd all, especially the advocates on this call, would agree with that, but maybe others too. Sarah Clark is asking further on the consultation. How are you reaching out to stakeholders? How are you involving them in this process?
Yeah, so I think that's a really good question. And to be transparent, some of this really started with way back, which feels like a really long time ago, a month or so ago, when I think Seattle Public Schools and King County were beginning to shut down. So we had started some conversations back then. We have not had advocates at the table in these conversations. It has mostly been focused around health, and we've had labor at the table. So I think now is a time where we can step back and think about what that looks like as far as participation. We were also asked by the Joint Information Center to take on coordination of conversations related to childcare and health. And so that piece is folding into the childcare task force, or our emergency care work that's happening. So I'm happy to go back and do some thinking on that. Folks that you all might know who are sitting on there are like Schools Out Washington, Boys and Girls Club. We've got Sydney from the governor's office, OSPI, CCA.
Excellent. I wonder if any of the parents want to ask a question, if you want to unmute yourself. I know we have a lot of parents on this call too, and I don't want to dominate with advocates and providers. So if there's some parents out there that you have a question you want to ask.
Hey, Joel, this is Kevin.
Hi, Kevin. How are you?
I'm hanging in there. So I've had a lot of parents ask about this. So they were working and now they're they were getting daycare. They had to work so many hours. Well, their business is all closed. And I think Jason might address it, but I just want to make sure. So if their child's still going to daycare and they're not being able to work, and some of them even haven't, some got laid off and some are just on, they're not getting a paycheck right now. Do they still have to pay that copay, or are they going to suspend that until they get back to work?
Yeah, so there's a couple things wrapped in that. Thank you, Kevin. Family eligibility, ongoing. I didn't talk about folks who are currently in their certification period who are either laid off or have decreased hours. Thanks to the Early Start Act, we have 12-month eligibility. So families who establish eligibility, their eligibility for childcare continues for 12 months as long as they remain under 85% SMI and they don't end up with $1 million in the bank. Like, and they still stay residents of Washington. Those are like the only 3 criteria for the 12-month eligibility. So families who are recently certified, who are now laid off, they can still use childcare. Their children can participate. There's no problem there. When it comes to copay, we are waiving copays for April, May, and June only. But families who experience a change in circumstance can call the contact center and ask for their copay to be reconsidered based on their current income. Initially, when we were looking at this being a 2-week or a 4-week thing, we weren't taking a lot of those changes into consideration because that's something we call consider a temporary change. But now that we're going on to 2 and 3 months and probably much longer, we're acting on those changes and we can reduce copays. So there's a lot there. Families can report the decrease in income. We can reduce their copay. Their certification will continue through the end of their 12 months. It's the folks that had their recertification due in March, April, and May, where we're considering those activities that they've lost due to COVID to be continuing activities and recertify for 12 months. That's where we're at with our current emergency rules and our current authorization, because all of these things, like Nicole was mentioning, cost additional money. And so we have to have approval on everything that we do if we're spending additional money. And that's today, as we sit today, where we're authorized to change the subsidy program, basically. I think that answered everything, Kevin.
Yeah, thank you very much. Yeah, thank you.
Any other questions out there? Just open it up. You know, while we're waiting, Jason, talk to us a little bit about how many people are utilizing childcare subsidies now versus, you know, whatever our 33,000 cap, and how does that impact things? I'm assuming that there are fewer people utilizing childcare subsidies, but I don't know that.
Yeah, generally, the last time I looked, it was maybe a couple of weeks ago. We don't confirm it or finalize what our costs are of our caseload because it takes us up to 6 months to figure out how many people actually utilize and claim care. We have a legislatively mandated cap at 33,000 cases, and that's 33,000 paid cases per month. At the last, and every quarter we go through a process where we look at the Caseload Forecast Council, and we also go through the per cap technical work group, which are work groups that give information to the ledge around our expenditures. The last time, like round numbers, were around 26,000 paid cases in November and December-ish. And so it has actually stabilized there for the last 2 years. We had kind of seen a steady decline month in and month out. And there's a lot of things contributing to that. But that was the last number. So we're around 26,000 paid cases, just without getting into this day, this month kind of thing.
Does that impact our budget in any way? Does that free up money? Are we susceptible for someone to sweep it and vacuum that money up?
Part of the caseload forecast process is anticipating what the paid caseloads are and what the ultimate investment is. So it is possible for while we invest up to $33,000 to start with, if we don't get our caseloads to that point, that money may get moved to other things.
Okay. Let me go to the chat. Let's see where. Okay. Denis, I think that's how you pronounce your name. If a family's enrollment status changes within the March 16th to June 30th timeframe, part-time to full-time, may we bill them for them while closed, or is billing based on their enrollment status on March 16th?
So very specifically, when we're looking at subsidy is based on the family's eligibility, and so providers need to be authorized for us to be able to pay them. When it comes to charging the families, if, say, in this case, the family lost eligibility on May 30th and is not eligible in June, the family could be responsible for the cost of care. That depends on the contract and each provider's agreement with their families. I think kind of going into this, that was a hot issue for private pay folks, between private pay families and providers, as we closed down and what the expected payments were. I'm not well versed in that area specifically, other than it's not subsidy.
Okay. Kelly Martin asks, is there any possibility of seasonal camps to be eligible for subsidy?
So that's something, as Nicole was mentioning, around some of the possibilities, and we are not looking at seasonal camps to receive subsidy at this time.
Okay. Hava is asking, I've had a family who is set to be reauthorized at the end of their 12-month WCC approval in May, and she expects now to be over income for WCC because she's continuing to work as essential personnel. Has there been any discussion considering extending existing benefits families through this time? Our agency is facilitating the Seattle and King County subsidy programs, and yet those all end in June. As such, this example family would be without subsidy support again 1 month later.
Yeah, this is definitely some of the cases that, again, that Nicole was mentioning, like how do we support essential workers, especially given that a lot of the essential workers are above the 200% FPL of working connections. We don't have any programs in the works currently for folks who end up being over 220% of the FPL at reapplication. We can look at family circumstances, and if, for example, this family was only over income for like a month or two due to some very extreme circumstances or unusual circumstances, like working double shifts every other day or those kind of things, we can address that with the income. But what we are also finding, and we find that generally in the caseload, is that the FPL isn't keeping up with the state median income, and folks who are working these essential positions are tending to be over income outside of any kind of additional increase in hours due to COVID response stuff. So that was a long answer for, at this time, no. The city of Seattle does have their program, but I don't know how that's impacting going into the new year, as they are looking at their own subsidy program, what they're doing for emergency essential workers as well.
Sarah Clark's asking, have you given thought to what the caseload might look like, as things reopen, so you're doing some forecasting on.
Yeah, and if any of you guys know exactly what's going to happen in the next 3 months, please send me an email or a message and say, hey, this is what's going to happen. Because honestly, like, this is what's keeping me up at night, of trying to figure out what's going to happen, because we have to have capacity for folks to go back to work. So, and when folks go back to work, we're going to see an increase in our caseload. And the most recent examples, if we go back to 2008 to 2012 with the last recession, we saw caseloads increase, and we actually had to make a number of policy changes to decrease the amount of uptake. where we cut the FPL and those types of things. So if that kind of history repeats itself, yes, we will see a significant increase in cases as we get back to whatever business is going to be in the future.
I think, Jason, the big difference here in thinking about this from my perspective is when that happened, we didn't have things like social distancing and a pandemic in place. And so I was just talking with Vicki Ybarra today, who's our director of the Office of Innovation, Alignment, and Accountability, around how we start to make some assumptions around supply and demand, because we're not really sure how families are going to react to this, to being reopened in some of those pieces. So I think, like Jason said, if you have a crystal ball over the next 3 months, and I really think it's over longer than that, I think that we may see some bubbles as things start to get phased in.
Yeah, thank you guys. I want to create some space for people to ask questions, but I'm kind of, as I'm thinking about things, I wonder what each of you would say to federal advocates. If you had more money and more resources, what's the one thing that you guys aren't doing now, but you might do if you could get some more resources into the state? Jason, everybody's looking at you. What would you do, man?
Oh, I was wondering if you were asking who you were asking. Like that's the miracle question, right? I think, and I'll just speak candidly as I can with this recording button flashing at me. I think that just generally the emergency impact that we've seen has shined a light on the importance of providers and childcare providers being very essential for families, for children, and for the economy in general. And I think that this is the wrong way to really highlight that, but it is definitely something that's highlighted. And so going forward, and I don't have answers to how to do this, but how can we further support that community and grow and have everybody understand the importance there of not only how it supports the economics of the world, but also it supports the children and their success. So basically it just comes down to getting additional investments and increasing access to more children to high quality care. And however we can do that, I think is key. And that's where I'm at.
Yeah, thanks. What about you, Nicole? What would you do if they could write you a check now?
So this is Nicole speaking, not
That's okay.
DCYF.
This is just a small group of us. It's like, this is like a therapy session. Two of us here.
No, I just like my disclaimers out there.
Yep.
I agree with a lot of what Jason said. And one of the things I was thinking about too is really, I wish the money was out the door already right now. So I just want to acknowledge that for existing providers. And I think the second piece is, yeah, how do we actually look at what it's truly going to cost, right? Moving forward, and have actual adequate funding to do that, and to do that in a way that makes sense and honors the work that everybody is doing. And so I think increased dollars around rates is essential related to this. And I think we also need to understand what is needed for folks to remain open in a deeper way than we do right now. And yeah, just making sure that folks have what they need to stay open and provide care. It's essential for not only work, but for our children to have a safe place to go and to be ready when they go to school. And I also want to acknowledge that the school age piece is not lost in this conversation. You know, I think this really, really highlighted for folks that when the schools aren't there, the hole that leaves. And so I think, again, also thinking about that school age and youth piece and how do we bolster that?
Yeah.
Here.
Yeah, you know, we have a few more minutes. I think what might be important, and I want to make sure we don't miss, are those that are representing immigrant communities. I was on a call recently where the immigrant communities are really suffering through this, whether it's fear of public charge or being able to access various benefits or language issues. So I'm wondering, I don't mean to put NIMCO on the spot, but from One America, I wonder, NIMCO, what your thoughts are, if you have any questions you'd want to ask our friends that manage the child care program. I want to give you some space too.
Absolutely. Thank you so much for that. I've just been on a few calls earlier today, and I've been wanting to share the experience of what providers are really dealing with. And so one of the ways that I've been sharing that is by sharing a quote that one of our providers shared with me, and I think that really stood out. Just really quickly, she said, "I'm a childcare provider that usually has 8 children at my in-home childcare. At this moment, I care for 4 children, and 3 of them are children of essential workers. I've been very afraid of getting me and my family sick with the coronavirus. I've been able to get some supplies, but it's not nearly enough to keep my space clean. It's also been hard to get guidance on what to do or whether I should even stay open. I know there's a lot of need for childcare providers, especially for healthcare workers and other essential workers. And the majority of the children I care for are children of essential workers at the moment. I've tried to go and get cleaning supplies myself, but I've not been able to find nearly enough. I'm worried about what this means for my family. I'm staying open because I don't have another choice. My husband is currently not working, and I'm the sole earner for my family at this moment." And I think that really sheds light to what immigrant providers, parents and caregivers are experiencing at the moment. And one of the bigger issues, I think more broadly, is language access for information, whether it includes testing availability and access, but also really guidance around primary and secondary exposure. They really need supplies to ensure their safety of the workforce and of families as well. And a lot of them just want to better understand the subsidy payment expectation. So really thinking about payment. We're glad that there's payment based on enrollment rather than attendance. And I think a lot of providers are grateful for that. And then lastly, I just want to share one of the things that they're experiencing is not just the lack of information or not having that in a timely manner, but also misinformation in this challenging environment, and would really need some resources in multiple languages as well.
Yeah, thank you.
Sorry, that was a mouthful, but
no, I'm glad you shared that. I'm sure they are as well.
Thank you.
Well, we have a couple minutes left. I wonder, do you guys have any final thoughts? What's going to happen over the next week? Like, what are you guys working on, trying to think through? How can the community at large give input? I think that's important. I know it slows things down, of course, and it's hard in an environment like this to slow anything down. But how can, kind of going back to Sarah's question, you're working on some stuff, you're trying to think through some of these policies. How can people with lived experience or advocates or other folks weigh in, help you think through this? And what are those issues that you're really struggling with now and wrestling with? Maybe that's a good way to close our conversation.
So I would say that we've received some feedback from a variety of calls like this, through the Child Care Collaborative Task Force, other pieces, and I feel like resoundingly what I'm hearing is, whether you call it hazard pay, whether you call it a grant or a stipend, just the need for some dollars to sort of bridge some things right now. And so that's really where we're focused on, is what could that potentially look like. So that's, I think, the biggest piece that we're working on right now, and have been asked to do that in some respects in a smaller group. And so I'm trying to get some buy-off from Secretary Hunter, but really that is informed by, I think, a lot of what we've heard.
So Nicole, just to be clear, that your focus, at least in the very short term, is trying to think through benefits and pay. You can call it hazard pay, whatever you want, but trying to get some extra support to childcare folks that are on the front lines. Yeah.
Yeah, and I think the first thing is, how do we look at that 58 million in the one-time funds and figure out the best way to get that out the door and get buy-off on that to stabilize right now. And then, I mean, these things are sort of happening simultaneously, but then really looking at what do we need to do for future state, and sort of what is that phased in future state.
Mm-hmm.
And so I would just say, I think our biggest thing right now is sort of like, what are the biggest questions we have? I think the biggest questions, or what we need help with, is that there's just going to be a lot of questions for a long time. Nobody's ever really been through this in this space. And so that's what keeps me up at night. I will tell you that, is I just want to figure it all out and get a solution out there. But that's not the way this is going to work. And so I think flexibility throughout the process is good. Jason?
Yeah, I know, Jason, you're working on a lot of stuff, right? You're pushing out student parents, homeless grace. I mean, you got other stuff even beyond this, right?
Yeah, a lot of the things from the ledge this session and last session, we've kind of tabled, and so we're working through all of the changes that they've asked us to make, and those are just more of the ongoing normal policy processes. I would just echo what Nicole has said around trying to get that 58 million out as quickly as we can. But I'm always the Debbie Downer on this and say, you know, the 58 million, if we look at all of the other federal programs, like, it goes so fast. And so we can't do everything that we want to do. And that's those tough decisions. And I don't have answers for those. But I know we want to get that out and as quick and as we can.
Yeah. Thank you. Well, it's 4 o'clock. I want to respect these guys' time. They spent a good hour with us, and I appreciate it. We had just want to, let's see. Okay, I'll read Hava's last comment. I would really like to highlight again that, along with considering providers, that families farthest away from opportunity, especially those experiencing homeless, need to be another focus of your immediate concern. In addition, rethinking the idea that providers closing because of director, student, staff fear is a valid explanation in these unprecedented circumstances and should be accepted as COVID-related closure, especially for family childcare. And I think, and Jason, it sounds like you answered that a little bit, that you're providing you're providing a more expansive definition of closure, it sounds like, and how you can support providers than previously. Is that right?
Yeah, it's not a direct diagnosed case, but a number of reasons related to COVID. I think when we say fear, Nicole mentioned that fear isn't necessarily a valid explanation, but if you look at the CDC definitions and say, I have staff who are in these high-risk categories, that goes from fear to the science-based backup of CDC and Department of Health and saying, hey, you should not be providing care or having large group sizes, those kind of things.
Yeah.
The point is that,
so hopefully that helps a little bit.
Did specifically mention fear not being considered a valid reason for closure unless there are those extenuating circumstances, but a lot of family childcare providers have spouses and kiddos also at home and don't necessarily have immunosuppression or other reasons to be at high risk, but that in this situation, in a pandemic, I think that particularly family childcare providers not feeling comfortable with a lack of guidance and a lack of supplies to have kiddos, especially of essential workers in their home, is a valid reason to have a COVID-19 closure, even if they don't have asthmatic family members or folks who are immunosuppressed in the household. And that's my point, as something to consider about not dismissing fear as a valid reason for a COVID closure, especially if you're running a program in your home.
Yeah, and they're in a tough spot, right? They don't have the political power to navigate this, and there may be language barriers and other things that they're kind of at a power trouble, right? I don't know what the word, I'm trying to find the right word, but imbalance at least. So,
Right.
well, hey, Katie.
Hey.
Hey, you're back, and you have a castle back there.
I
That's
am.
a nice way did you want to say anything as we're closing?
No, I don't. I will. I'll talk to Nicole and Jason after this. If you're comfortable with I recorded this, but if you're comfortable with us sharing that, I will do that. You can certainly say no. And yeah, I invite folks to come to our Monday COVID calls too, because we do regular updates on a wide variety of topics on that one. So.
And you're welcome if you're not a Head Start ECAP person, quote, member or something. Feel free to also come to our calls, where we are an open place. So we want to invite you, if you're outside of our Head Start ECAP community, please join our calls and add your thoughts in. It really helps us think through these issues and hear what's happening. So, but Nicole and Jason, really, I thank you guys. You did a wonderful job answering these questions. This is a very difficult time, and I can tell you're spending a lot of energy and hard work trying to make the system work for everybody. So I appreciate what you guys are doing. And I think with that, we'll close up. Thanks, everybody.
Thanks, you guys.
Thanks for everything you guys are doing.
Great job, Joel.
Thanks, Jason. Thanks, Nicole.
See you guys.